Okay, so let's get started. So good afternoon and welcome everyone to Preventing Healthcare-Associated Infection, HAIs, Catheter-Associated Urinary Tract Infection, known as CAUTI. This session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health in partnership with the CDC. I'd like to thank you all for joining me today. And before introductions, again, last time here, I'd like to direct your attention to the chat box, and you will see a link to our pre-session survey. And again, if any one of you are wanting to receive CNE, CE, or certificate of training, you want to take a moment to fill this out if you haven't already. I'd like to introduce Abby Anderson, who is our Project Firstline Rhode Island project assistant. And Abby will be posting information for you throughout the webinar via chat today. So please take a moment to introduce yourselves in the chat and tell us where you're from. And as you're doing so, I'd like to introduce Dr. Kearney. Here she is on camera to introduce herself.
Good afternoon, everyone. We're super excited to have this presentation here for you today and hope you get a lot out of it. Please feel free to ask any questions. Thanks for being here.
Thanks, Dr. Kearney. And for those of you who don't know me, my name is Lisa Ledoux. I'm an infection prevention training liaison for Project Firstline Rhode Island. So again, if you'd like to introduce yourselves, and I thank you for putting your name and where you're from in the chat box. So in this session, there's going to be some opportunities later on at the end for you to participate and interact by answering some questions. And we also have a case scenario we'll be going through. And also to let you know, Project Firstline, the team is behind the scenes in support of this webinar today. So here are the continuing education criteria for those of you who are attending and would like to receive CNE credit. This session is approved as one contact hour. This nursing continuing professional development activity is approved by the Northeast Multi-State Division Education Unit, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. To receive your certificate of training, CE, dental IPC, or CEEMS, you'll need to complete the following. Complete the pre-session survey, attend this entire webinar, and also complete the post-session survey. And in order to receive your CNE credit, you will need to complete the following: the pre-session survey, attend the entire webinar, the post-session survey, and then linked to the post-session survey will be a quiz that will be emailed to you to complete. So our agenda, we just went over our welcome and introductions. We will next go over the learning objectives. What are healthcare-associated infections? Define CAUTI, infection control actions to prevent CAUTI. We'll go have our knowledge checks and case scenario, key takeaways, end of session feedback, and then go into our Q&A session. In the learning objectives for today, understand what an HAI is, define a CAUTI and identify the risks of a CAUTI in a healthcare setting, know the signs and symptoms of a CAUTI, understand how it spreads in a healthcare setting, and know the infection prevention and control practices to prevent a CAUTI. So let's start with understanding what are HAIs, healthcare-associated infections. Healthcare-associated infections are infections that people unintentionally get while they are receiving healthcare for another condition. They are a serious threat to healthcare safety, and preventing HAIs is a top priority for the CDC and its partners. Some types of healthcare-associated infections include central line-associated bloodstream infections, known as CLABSI, catheter-associated urinary tract infections, CAUTI, which we are reviewing today, surgical site infections, SSI, ventilator-associated events, which is known as VAEs, Clostridioides difficile infection, CDIs. So today we're going to be talking about CAUTIs, and this is our first training of our 4 HAI refresher training series. So Project Firstline Rhode Island will be offering trainings on each of these in the upcoming weeks. All right, let's get started. So again, we're going to review in detail what a catheter-associated urinary tract infection is, who's at risk of getting one, and the serious complications that can occur, and how healthcare professionals can prevent them. The urinary tract is normally sterile. So a urinary tract infection, known as a UTI, is an infection involving any part of the urinary system, including the urethra, bladder, ureters, and kidney. The infection occurs when germs enter the urinary tract through a urinary catheter and cause infection. It's important to note that the urinary tract for some patients, especially females, can be colonized with mixed flora and candida. The asymptomatic bacteria is the presence of bacteria in the urine without any symptoms of a urinary tract infection. It is common, especially in older people and those living in long-term care facilities. Having bacteria in the urine can also create a wide variety of symptoms with varying levels of severity. A patient may have bacteria with related symptoms, such as burning or discomfort with urination, lower abdominal pain, or blood in the urine. This infection can travel up the urinary system to cause more serious infections and possibly lead to sepsis. Next, you have the indwelling urinary catheter, the IUC. It's a drainage tube that is inserted into the urinary bladder through the urethra. It's left in place and it's connected to a drainage bag to collect the urine. And catheter-associated urinary tract infection, CAUTI. CAUTI is a UTI associated with the presence of an indwelling catheter, urinary catheter. So here are the types of urinary catheters. First, we have the indwelling catheter. An indwelling catheter is a thin hollow tube inserted through the urethra, or it could be surgically inserted directly into the bladder through an incision in the lower abdomen, known as a suprapubic. Once inserted, a balloon is inflated, which keeps the catheter in place to collect and drain urine. An indwelling catheter may be left in place for a period of days to weeks. And the catheter is connected to a drainage bag that has a valve that can be opened to release urine, as well as a separate port that can be used to collect urine samples. Next is intermittent catheterization. It's brief insertion of a catheter into the bladder through the urethra to drain urine, followed by removal. So it's designed for a one-time use, and it's discarded after that use. And it can be done multiple times per day. Some of you may have heard of it as referred to as straight cathing or in and out catheterization. And this is done for patients that are unable to fully empty their bladder on their own due to possibly a spinal cord injury or multiple sclerosis or even an enlarged prostate. And last, there's an external catheter. It's a urine containment device. It's attached to a urinary drainage bag, and it fits over or it adheres to the genitalia. So an example of an external catheter is a soft, flexible sheath that fits over the penis, known as the condom catheter, and then that will be, attached to a drainage bag. And also for females, it's like a suction device that just sits in place and collects the urine. And some of you may have heard of a PureWick, which is one brand of one. Okay, so those are the types of the catheters. And next, some CAUTI facts. CAUTIs are of the most common HAIs in the healthcare setting, and about 75% of UTIs developed in hospitals are associated with a urinary catheter. Urinary catheters are among the most common medical devices used in adults, and daily risk of developing bacteria varies. It's estimated that approximately 15 to 25% of hospitalized patients will have an indwelling urinary catheter at some point in their admission, causing a substantial strain that's placed on patients, healthcare providers, and the healthcare systems. CAUTIs can also increase the morbidity and mortality. They cause an increase in prolonged hospital stay, and they can be very costly and lead to some serious complications. And here are some of the serious complications that CAUTIs can lead to. First is cystitis, and that is inflammation of the urinary bladder. Pyelonephritis, inflammation of the kidney, typically due to bacterial infection. Septic shock, which is potentially fatal. It's a fatal condition when organ damage occurs from an infection. Bacteremia, an infection of the blood caused by bloodborne pathogens. And also, again, as I mentioned earlier, it can lead to a prolonged hospital stay, physical decline, and even death. Patients who have an indwelling urinary catheter in place often have mobility impairment, which can lead to other serious complications such as blood clots, pressure ulcers, as well as increased risk for delirium and falls. And here are some common signs and symptoms of a urinary tract infection. Signs of a UTI can include abnormal urine color or cloudy urine, follow or a strong smelling urine, blood in the urine, which is called hematuria, altered mental status, especially in the elder population. Some symptoms that the patient may complain of can be malaise, which is just not feeling well, just not having not feeling good at all. Patients may experience chills, vomiting, frequent urination, a strong urge to urinate, painful urination, pressure or pain in the flank area in the lower back. Certain patient populations are at an increased risk for developing CAUTIs. Pregnant women experience hormonal and physical changes during pregnancy, which make them more susceptible to UTIs. Elderly patients may have reduced immune function and impaired mobility. Patients with diabetes are at risk for getting CAUTIs. And that being having diabetes coupled with the fact that high blood sugars can provide a perfect environment for bacteria to thrive. Hospitalized patients such as ICU or surgical patients often require prolonged catheterizations than if they have any other medical conditions. UTIs are more common in females because their urethras are shorter and closer to the rectum, and this makes it easier for bacteria to enter the urinary tract. And there are also specific factors that have been shown to increase the risk of developing CAUTIs for patients. And these include the duration of the catheterization. So essentially, the longer the catheter is in, the higher the risk for developing a CAUTI. Interruptions in that closed drainage system, whether it be unintentional or accidental. And if the patient is neutropenic or immunocompromised and has underlying renal disease, they're at risk. So how do we test for a UTI? Testing for UTIs is based on symptoms. You want to review symptoms carefully and perform a physical exam. Suspected UTIs are the common cause of inappropriate antibiotic prescribing. So it's so important to remember that the presence of bacteria alone in the urine does not necessarily constitute a UTI. And without symptoms, it can be considered non-infectious and point to just colonization of the patient's urinary tract. So when is it appropriate or not appropriate to test for a UTI? Knowing when to test for UTI is important so we can avoid, again, unnecessary treatment. When looking at indications for testing for a UTI, it's important for the provider to assess those common signs and symptoms that I just mentioned on the previous slide, and also determine if these symptoms are an appropriate indication for testing. Additional signs and symptoms that may warrant testing include altered mental status or rigors, which are violent, shaking chills. There are, however, some inappropriate indications for testing that can often be confusing, such as when a patient has odorous, cloudy, or discolored urine. There are many potential causes that can change the characteristics of urine, including hydration status. I'm sure if you feel like, dehydrated, your urine becomes more dark, more concentrated. Also, food that's recently consumed can alter the characteristics of urine, and some medications that we take. Additional inappropriate indications for testing include a urinalysis to culture without any symptoms, and antibiotics are given once the infection is confirmed. Excuse me. So when considering the factors that influence whether a patient develops a CAUTI, it's helpful to understand what different organisms can actually cause a CAUTI and how they enter the body. What are their routes of entry? So here are some common organisms that can cause a catheter-associated urinary tract infection. And these organisms can enter the body when a foreign device, such as a urinary catheter, is inserted into a patient's urethra. The catheter tube provides that pathway for the bacteria to enter the body and potentially cause infection. So let's look at the 5 elements of how germs spread and how they can cause infection in detail. And as I review each of these elements, think about how they relate to your workday and the tasks that you perform. Where do you see the possibility for germs to spread in your workday? So first off, you have a reservoir, which is the source of the germ. This is the place where the germs live and multiply. It could be an infected person, a contaminated surface, or even an animal. And then you have pathways. This is how the germs travel. This is the method by which the germ moves from the reservoir to a susceptible person, such as through direct contact, airborne transmission, or contaminated food. And then you have your susceptible person, and that's someone who can be infected. This is someone who is not immune to the germ and can potentially become infected. The ability to bypass the body's defenses. That refers to the body's natural mechanisms that fight off infection, which a germ does need to bypass and cause illness. Germ survival, germ's ability to survive, the ability for the germ to stay alive outside of the body long enough to be transmitted to another person. So it's important to know that removing any one of these elements eliminates the occurrence of an HAI. And here in this image, it brings together those 5 elements pretty much and how a CAUTI can occur. Indwelling urinary catheters quickly become colonized with microorganisms after insertion. And then these microorganisms produce proteins and other substances that are sticky and facilitate the formation of biofilms. These biofilms can ascend, travel up to the bladder within 1 to 3 days. Shedding of bacterial cells from the biofilms can lead to an infection. And some of these biofilms block the catheters, which can lead to kidney or bladder stones. Biofilms can stop antibacterial agents from reaching their target and not allowing the antibiotics to do their job and fail to treat the infection. Biofilms can form on long-term catheterized patients. Over time, the urinary catheter becomes colonized with microorganisms, causing them resistant to antimicrobials and host defenses, and virtually impossible to eradicate that infection without removing the catheter. So just thinking of all this, imagine how colonized, a long-term indwelling catheter would be, longer than even a couple days, even 4 days. So how does bacteria or other microorganisms get into the urinary tract? The microorganisms that cause a CAUTI can come from the patient's own body, which is referred to as endogenous. Endogenous sources include colonization of the meatal, rectal, or vaginal areas. Exogenous refers to outside of the body sources, which includes contaminated hands of healthcare personnel or equipment. The image on the right of this slide is a common image that is used to demonstrate the 2 routes of entry. Microorganisms can enter the bladder via one of these 2 routes. The external surface of the catheter, which is the extraluminal, and that's during insertion or manipulation of the catheter. Or the inside of the catheter, which is called intraluminal, and that can come from a break in a closed drainage system, contamination from the drainage bag, or urine stasis in the bladder or the bag. So contamination can occur at multiple points during the life of the urinary catheter. In this slide, you can see the image of a catheter system and see when and where contamination can occur, such as migration, that's the movement of microorganisms along the external surface of the catheter, reflux of urine from contaminated drainage bags or collection bags into the bladder, and contamination can occur during catheter insertion, at the junction between the catheter and the drainage tube, at the drainage port when emptying urine from the collection bag, or during specimen collection. So after ensuring the following, knowing that proper indication for catheterization is there, proper testing has been done, and confirmed results. Now we go to proper treatment. It's critical for a successful CAUTI program. So as I've mentioned, UTIs are a common cause of inappropriate antimicrobial prescriptions in patient settings. To assure for appropriate use of antimicrobials when treating UTIs, I think we could maybe refer to the 5 rights of drug administration to help direct your treatment. So you have the 5 rights for CAUTI treatment can include, is this the right patient being treated? Is this the right medication prescribed for this patient's symptoms and culture results? A patient with a positive culture but no symptoms would be the wrong patient to receive treatment for a UTI. Looking at whether the right dose is used to treat the infection is also important. Is the treatment prescribed specific to the organism identified in the culture? And is it the right time and the right route when ensuring that the UTI is treated? The most important risk factor for developing a catheter-associated UTI is prolonged use of the urinary catheter. So for every day that a urinary catheter remains in the body, the risk for a CAUTI increases. It's estimated that half of the patients with urinary catheters do not have an appropriate indication for placement. Because of this, infection prevention is critical to prevent CAUTIs from occurring. Catheters should only be used for appropriate indications and must be removed as soon as they are no longer needed. So when looking at the overall lifespan of an indwelling urinary catheter, this is a good graphic to help visualize the process to manage a catheter. Breaking the catheter life cycle disrupts the progression towards a CAUTI. The first step is to avoid catheter usage whenever possible. But if a catheter is required, insertion must be done using aseptic technique and precautions to minimize the risk of trauma during insertion, such as appropriate lubricants and minimal attempts of insertion. The second step is to optimize maintenance and care of the catheter by maintaining a closed system, preventing the risk of contamination via hand hygiene and perineal care, then maintaining appropriate positioning to avoid obstructed urine flow and to keep the catheter secured. And the final step in the lifespan of a catheter would be prompt catheter removal when the indication is no longer applicable. There are several strategies that have been developed to aid in prompt catheter removal. Because there are many risks associated with the use of catheters, avoiding them whenever possible or reducing the amount of time when they are placed in patients is critical. In fact, the key risk factor is the length of time a catheter is in place. Unnecessary catheter placement should be reduced and duration of placement should be minimized. So what are care bundles? Care bundle is a set of evidence-based practices that, when implemented collectively, improve the reliability of their delivery and improve patient outcomes. They contribute to infection prevention and reduce unnecessary antibiotic prescribing, leading to decreased incidence of antibiotic resistance in healthcare facilities. So here are 4 important actions that are part of the CAUTI care bundle. Using urinary catheter only when needed, proper insertion, proper maintenance, and prompt removal. And I'll be reviewing each of these in a little bit more detail. So when is it appropriate to utilize an indwelling urinary catheter? We want to avoid as I've mentioned, we want to avoid them at all costs when possible. But there are many times when a catheter is necessary, such as treatment of urinary retention or obstruction that cannot be managed via straight catheterization, perioperative urinary management, so while a patient's undergoing surgery, prolonged immobilization and monitoring. So if a patient's, immobile for a very long time, you would indicate a catheter at that time. And then also another time that a catheter is indicated is for monitoring strict intake and output in critically ill patients. That's also when it's appropriate. Also, patients with severe sacral or perineal wounds that will require urinary catheterization to optimize their healing. And finally, it's appropriate to utilize an indwelling urinary catheter in a patient who is receiving end-of-life care for enhanced comfort. Some of the examples of when a catheter is not appropriate are for the convenience of staff, for routine patient comfort outside of end-of-life care, in a postoperative period without appropriate indication, or when a patient can independently void. So you want to consider alternatives. As I mentioned at the beginning of the session, there's those external catheters for males and females. Maybe performing that in and out catheterization might be appropriate. There's also an option for using bladder scanners, on patients who haven't voided for a prolonged period of time. And finally, the more traditional methods, including the use of incontinence products, urinals, bedpans. Next is proper insertion. And hand hygiene should be performed before and immediately after catheter insertion. Also, you want to maintain aseptic technique during catheter insertion. And proper trained staff should be the only ones performing a catheter insertion. You also want to maintain precautions, including the use of appropriate PPE, such as gloves, gown, and eye protection. And hand hygiene is one of the most important parts of CAUTI prevention. You want to observe the 5 moments of hand hygiene. Number 1, clean your hands before touching a patient. You want to do that to protect the patient against harmful germs carried on your hands as a healthcare professional. Second, clean your hands before an aseptic task. You want to protect that patient against harmful germs, including the patient's own germs entering his or her body. 3, the third moment is cleaning your hands immediately after an exposure risk to body fluids. Again, you want to protect yourself in the healthcare environment from harmful germs. And also clean your hands after touching a patient and the environmental surroundings when leaving, patient's room, for instance. You want to protect yourself and the healthcare environment from those germs. And lastly, clean your hands after touching an object and also touching anything in the environmental surroundings. And that is, again, protecting yourself and the healthcare environment from harmful germs. Another part of the CAUTI care bundle is proper maintenance. Securement devices. You want to make sure that a securement device is in place. And this device is used to help keep the catheter tubing anchored to the patient's thigh to prevent that catheter from sliding in and out. So it's a device that could Velcro around the patient's thigh and then also Velcro the tubing so that when the patient does move, it's not sliding in and out and bringing bacteria in and out of the patient's body. Also, the drainage bag. You want to make sure that's hung below the bladder, that it's always empty prior to any transportation, and that it's never touching the floor. Also maintain unobstructed urine flow. You want to make sure that tubing is patent and it's always flowing. Do not change catheters at set intervals. You want to only change a urinary catheter if there's an infection, a closed loop compromise, or if there is an obstruction. And maintaining sterile closed drainage system, keeping that all closed and sterile. And last, prompt removal. Monitoring of the indwelling catheter for prompt removal is important. You want to do daily assessment of the presence and the need for indwelling urinary catheters. Assess on interdisciplinary rounds, and that could be, doing those daily rounds with nursing and a physician, if you have a team, to assess the need to continue that catheter. Catheter removal reminders, are there stop orders in your EMR? There's also some facilities have nurse-driven removal protocols and algorithms, as well as performing voiding trials with the patient. So how can your facility help to prevent CAUTIs? So how healthcare facilities play a role in a CAUTI prevention by providing the following: making sure they've got policies and procedures in place. The education and training is also in place. Surveillance, monitoring and measurement, and also providing feedback. And I will go over each of these briefly next. So it's very important to distinguish between policy and procedure. A healthcare policy is a broad guideline or principle that outlines an organization's approach to a specific aspect of patient care, such as medication administration. While a healthcare procedure is a detailed step-by-step set of instructions on how to carry out that policy and practice. Essentially, policies define what should be done and procedures explain how they are to be done. And here are some examples of what can be included in a CAUTI prevention and policy procedures. A facility may consider having the types of urinary devices that are utilized within that facility, as well as a facility's policy for device insertion, maintenance, and also removal. Some example protocols and procedures that would include step-by-step instructions for how to perform under the urinary management, right? The task may include urinary retention protocols to help determine, when escalation to when a urinary catheter may be needed, right? So you'll have these certain protocols and then say, okay, this is, have the dates and times or a time frame on when to insert that urinary catheter. You have, insertion maintenance, and also removal procedures, as well as specimen collection and testing protocols. So all these are very important to have under policies and procedures in your facility when it comes to urinary catheters. One of the initial tasks that should occur is to educate healthcare professionals involved in the care of urinary catheters. Assess the competency in urinary catheter care for all healthcare professionals, performing competency-based training and education on the lifespan of the catheter, including catheter insertion, maintenance care, and removal. And to also, include in that training, make sure you have the appropriate personnel. Who are the people that interact with catheters, as well as including, that could be your nursing staff, physicians, CNAs, techs, surgeons, and also potentially travel or contract staff. There's an opportunity to look closely into departments to see if there are any non-clinical employees that have interaction with urinary catheters, such as transport staff, EVS, maybe dietary that are coming in and out of the rooms. You, would also want to look at the frequency of training. Are they trained upon hire, annually? Do you have skills fairs that offer some, training and updates? If remediation is indicated, you want to assess learning more closely and ensure best practice is attained, and always educate staff when new equipment or new protocols are implemented in your facility. And here are just, some other topics that are important to educate the staff with. Preparation. If they're going into a room, make sure they gather everything that they need. These kits are all different. Every facility has different kits on board. So you want to make sure that what is in that kit is what you need. And if you don't have it in there, make sure you have everything, with you when you go in to do that urinary cath insertion. Insertion, sterile technique, and make sure you have the appropriate supplies. Maintenance care, removal protocol, right? Provider order, versus a nurse driven, or the stop orders I mentioned in the EMR. Urine culture stewardship, culture indications, testing algorithms, specimen collection, and then bladder management, bladder scanners, toileting schedules, straight catheterization. So when looking at the process for surveillance, you want to assess the patient population, right? Are you performing surveillance housewide, or are you looking at specific high-risk units, such as ICU patients, let's say? And then you can review and select the metrics that you that would be applicable or appropriate for your facility. You can select outcome metrics like incidence of device utilization rates, or process metrics like insertion checklist documentation. You could look at contamination rates, and what I think is very important is hand hygiene compliance. That should be in there too. Then you'll collect your data utilizing sources from your EMR, your electronic medical record, lab results, and look at all your nursing and medical documentation. Then analyze your data, and finally report the data, report that data and share with relevant stakeholders, including frontline staff. Establishing an adherence monitoring program for core care practices. Our CAUTI core care practices used routinely in your facility. Again, inserting catheters only when appropriate, ensuring that only trained staff are the ones managing and inserting the catheters. Again, looking at hand hygiene, using aseptic technique. So keeping, having some monitoring program in your facility is really important because you won't know if you don't monitor. And looking at data and metrics, we know that the success of a quality improvement program can be measured by process and outcome measures. So as a reminder, outcome metrics look at the outcome of a result of care. And that would be incidence and utilization rates. So maybe you could look at CAUTI rates per unit or per hospital or per 100,000, per 1,000 days. 100,000 would be too much. In process measures, you're looking at the activities performed by the healthcare professional and the impact, right? You may look at the hand hygiene compliance. And again, documentation of catheter insertion and removal date, doing those daily assessments and documentations on the indications. And I wanted to share this report with you today. The CDC released the 2023 National and State Healthcare Associated Infection Program Report, which shows progress in preventing several important HAIs in acute care hospitals compared to 2022. This HAI progress report continues to show decreases in HAIs that align more closely with progress made prior to the start of COVID-19 pandemic in 2020. So all settings observed, all these settings on this graph right here, observed significant changes in at least one HAI. So you can see where the green downward arrow signifies a percentage decrease, and the red upward arrow signifies an increase in infections. And the NA indicates HAI-specific surveillance that was not performed in that facility. So for CAUTIs, 11% decrease in CAUTIs in acute care hospitals. There was an 8% increase in inpatient rehab facilities, and there was no change in the LTACs, the long-term acute care hospitals. So if you want to look at this further, Abby will show the link to she'll show the link in the chat box there so you can check it out. I thought it was really good timing when this came out, when I was getting this webinar together. And lastly, you want to have all this data available. It's very valuable, right? You want to be transparent, share the good, the bad, the ugly with your colleagues and your staff, including upper leadership and frontline staff. Provide regular feedback to help improve accountability, awareness, and get that engagement from the staff. When they understand it more, it probably gives them a little bit more buy-in. Present the data clearly. Highlight positive trends. Identify areas of improvement. And as I mentioned, engage staff in discussion and potential solutions. And ensure that open communication and transparency about the data and its implications. All right, we sure reviewed a lot of information today. So next, let's see how you all do with the knowledge checks in a case scenario. So I invite you to participate, have fun with it, and just share your answers in the chat. Okay, here are true and false. So first one, a securement device is not necessary for indwelling urinary catheter care. Is this true or false? So if you want to put your answers in the chat. A securement device is not necessary for urinary catheter care. Is that true or false? Thank you. I see you participating, and yes, the answer is false. Good job. Second, hand hygiene does not need to be performed if you are wearing gloves. Is that true or false? Wow, I see those coming in quick. Good job, everybody. The answer to that is false. Great job. And three, antibiotics do not prevent CAUTIs. Is that true or false? They do not prevent CAUTIs. True or false? Want to share your answers on that one? And the answer to that is true. Antibiotics do not prevent CAUTIs, right? They don't prevent them. That was the word. That was a tricky one there. And the last, catheter and drainage bags should not be changed at routine fixed intervals. Is that true or false? And the answer is true to that. right? So we don't want to change them at fixed intervals if we can, only if there's a obstruction, a blockage that will compromise the patient. Okay, let's go on to our next question. Knowledge check. What can be done to prevent a CAUTI? A, document the need for a urinary catheter. The position of the urinary bag should be below the bladder. C, wash hands before and after handling the urinary catheter. D, empty the urinary drainage bag before transport. Or E, all the above. So I'll give you a little bit and you can put your answers in the chat. And I see everybody getting their answers in there. Great job. Okay, the answer, it is E, all the above. So all of, A, B, C, and D, all of those can be done to prevent a CAUTI. Excellent. Good job, guys, and I appreciate your participation. Now we're going to move on to our case scenario. So this case scenario involves an ICU patient who has a urinary catheter because of recent extensive urological surgery. The nurse and transport personnel need to take this patient to radiology for a follow-up study. So in preparation for moving the patient from the bed to the stretcher, the transporter grabs the urinary catheter bag and places a bag on top of the patient's abdomen. The bag is approximately 2/3 full of urine, and the nurse notices that the patient's urinary catheter isn't secured to the patient's leg. Question, which actions place the patient at increased risk of developing a CAUTI? So in this scenario, what do you think? What are some of the things that I just read out loud that you pick up on that would actually place this patient at increased risk for developing a CAUTI? You could share your answers in the chat. Very good. Yes, placing the bag on the abdomen. Thank you, Nadine. There's a couple more things that were in the scenario. If you could think about, let's see, what other things would put this patient at risk? Very good. The bag is very empty. Bag's above the bladder. Sarah, everything. Drainage bag, 2/3 full. So very excellent answers. You guys all did great. So very good. So you identified the 3 issues that can lead to the development of a CAUTI. The transport personnel put the urinary catheter drainage bag, which has a measurable amount of urine in it, on top of the patient. So this is dangerous because the urine could flow back from the bag into the bladder. Also, you picked up on that the nurse realized that there's no securement device attached to the catheter to the patient's, to the catheter to the patient's leg. So by not attaching the catheter to the leg, it can lead to urethral irritation and the risk of bacteria entering the bladder with that moving in and out. And also the drainage bag was not emptied. So emptying the drainage bag will help keep the urine from flowing back into the tubing when the patient is moving. So you did great. And the worst thing that you can do in this case is to ignore a problem. So, if you would take that bag and empty it, right? You would automatically take the bag. Well, first of all, you take the bag off the abdomen and hang it on the stretcher below the bladder. Then you would empty it and you would make sure that securement device is on prior to him or her going down for testing. So you all did great, and I thank you for your participation with these knowledge checks. And we'll be moving on to our key takeaways. CAUTIs are the most common healthcare-associated infections. We reviewed that today, right? They occur when organisms enter the urinary tract through a urinary catheter and cause infection. Preventing CAUTIs by inserting urinary catheters only when needed, follow proper insertion and maintenance procedures, and removing catheters as soon as possible help prevent CAUTIs. And implementing evidence-based practices will also reduce CAUTI incidence. And as a reminder, those requirements that for receiving your certificate of training, in order to receive the certificate of training, as I mentioned at the beginning, you would have already completed the pre-session survey, participate with me during this whole live session, and complete the post-session survey. A link to for the post-session survey will be sent to you via email tomorrow, January 14th, and it will be available until January 20th at midnight. And once you complete the requirements, a certificate of training will be emailed in PDF form on January 23rd. For EMS and dental providers, this can be used towards 1 hour of continuing ed credit. And those of you that are looking for the CNE, again, you would have completed the pre-session survey. Also complete the post-session survey and the quiz, and that will all be emailed to you tomorrow. And this afternoon, the post-training resources and a copy of this slide deck will be emailed to all of you who attended today's session. So I invite you to join us next month when my colleague Jacob Figueroa presents Preventing Healthcare-Associated Infections. He'll be doing CLABSI, Central Line Associated Bloodstream Infections, on February 10th at 12 noon. CNE will be offered, so please share with your colleagues, and Abby will be sharing a link where you could sign up for this webinar and any other upcoming webinars. Oops, sorry, here we go. And if you did not enter email earlier in the chat, please feel to enter it now if you want to be added to our distribution list of upcoming trainings. You can also email Project Firstline Rhode Island directly if you have any questions. And you can click on our live events link through our website, and Abby will show she'll post that in the chat box, the link to that. And follow us on follow Project Firstline on social media, on YouTube, Twitter, Facebook, Instagram, and LinkedIn. And here are the references used for today's session. And if you could please take time to complete this quick end of session feedback poll. This will help us to improve future trainings to suit your learning needs. So I invite you to complete that. It's a 3-question poll. Give you a few moments to complete that, and then we will move on to our Q&A. If anybody has any questions at this time, please feel free to ask. You could put it in the chat. And also, if you think of any questions later on, after we end this, like I said, email Project Firstline, and someone from the team will definitely get back to you. And I really appreciate you all joining me today and reviewing CAUTI. Wait a few minutes if anybody has any questions. Thank you, Barbara. Just a little bit of time. I don't see any questions right now. Dr. Kearney, do you see any?
No, I'm not seeing any right now.
Okay.
But anyone can reach out to us after today's session with any questions, or let us know how we can support you. We're looking forward to completing the rest of the HAI lectures in the coming weeks and months as well. So keep an eye out for that.
That's great. We sure are. All right. Well, if there aren't any questions, which there aren't, we thank you again for joining us, and enjoy the rest of your afternoon.
Bye, everyone. Thank you.
Thank you.